Continuing on with chapter 12, we're now in section 6, talking about the other major portion of the central nervous system, which is the spinal cord. Remember, the central nervous system is the brain and the spinal cord. The peripheral nervous system are all the nerves outside of the brain and spinal cord. Right, so the spinal cord, composed primarily of nervous tissue, no surprise there. We've talked about that already. Responsible for relaying and processing information. Right, there is some processing that happens in the spinal cord. Not all processing happens in the brain, even though it's much less complex than the brain. I would say the brain is probably the most complex organ in your body, but it's still vitally important. The spinal cord is still vitally important to the nervous system. So its two primary roles are relay station. So that's probably its main role, taking sensory information, relaying it to the brain, taking motion and relaying it to the motor nerves in the peripheral nervous system. All right, so passes through the spinal cord. All right, so it's this intermediate point between body and brain. And this is the means by which the brain can interact with the body below the head and neck. Now, above the head and neck, you have the cranial nerves, which connect directly to the brain, right? So there are nerves that connect directly to the brain of the peripheral nervous system that do not go through the spinal cord, right? Just remember that. The spinal cord is also a processing station, some less complex activities. We're going to talk about reflexes, which do not require higher levels of processing. Your body knows what to do right away. It doesn't have to go through the brain. All right, so let's talk about the protection of the spinal cord. Very similar to that of the brain in some ways. So the brain's meninges pass through the foramen magnum to provide continuous protective covering of the spinal cord and some of the distal nerves at the base. So we have the spinal meninges, very similar to the meninges we talked about in the brain. So dura mater, arachnoid, pia mater, structurally similar to the brain meninges, except that the spinal dura only has one layer and pia mater has some structural enhancement. So very similar structures. Spinal dura does not have this periosteal layer, consists only of the meningeal layer, so single layered versus double layered, and the spinal pia has added function of anchoring spinal cord to surrounding vertebral cavity. Then pia extensions, right? Denticulate ligaments pass through the arachnoid and adhere to the dura mater. And then we have what we call the epidural space. Now, you have this sort of epidural space in the brain, but you also have it in the spinal cord. This is the when women are talking about women give birth during pregnancy, they talk about this epidural space, which is an actual space due to the absence of this periosteal dura, due to the absence of that second layer of dura, which we do have in the brain, but we don't have in the spinal cord, between the meningeal dura and the walls of the vertebral foramen. Space is filled with veins and adipose tissue. That's what that space is filled with, cushions and protects the spinal cord. And when we talk about an epidural, giving an epidural, when women are having the wanting to be relieved of the pain, some of the pains of pregnancy, we're talking about this space right here. We also have a subdural space, only potential space, like epidural space surrounding the brain, only a potential space. Dura and arachnoid are normally adhered to one another, so not really that much space there. Then we have the subarachnoid space between arachnoid and pia mater, and that's filled with cerebral spinal fluid, which is, like we said, very similar to plasma, blood plasma. Okay, and that's also a useful site for withdrawing samples for laboratory testing. So when they're testing for meningitis, one of the places they test is they go into this subarachnoid space, draw some CF, some cerebral spinal fluid. I've actually had this happen with my father when he was being tested for meningitis. I was actually in the room helping to hold him still while the doctor injected a needle that was guided by, they were watching it on a screen, so guided by technology that they could view inside the body. And they were taking a sample of his cerebral spinal fluid to test to see if he had meningitis when he was really sick in 2013. He ended up not having meningitis, but he was still very sick, and it took a while for them to figure out exactly what it was. Right, so this is the protection of the spinal cord, how it's layered: dura mater, subdural space, arachnoid matter, subarachnoid space, and the pia mater, which is very much on the spinal cord. This is looking at a transverse section. Epidural space, see, that's where we have veins and adipose tissue, cushion, protection, dura mater, pia mater, arachnoid mater, dura, arachnoid, pia. Okay. Note this is the bone structure here, your vertebrae. So a lot of protection for your spinal cord. And this is actually the gray and the white matter here. Epidural anesthesia, local anesthetic. I just mentioned this. Medication is injected into the epidural space. That's this space right here, epidural space, through an inserted needle. Causes numbing, inability to transmit motor and sensory impulses of nerves extending off the spinal cord below level of induction. So remember, spinal cord receives information. We're going to talk about the structure in more detail, but nerves come from the body to send information to the brain. We talked about lidocaine, dealing with like when you have dental surgery or dental work, how it can numb it. Very similar idea here. You inject into the epidural space, and so any information that is being sent below that point to the spinal cord does not travel to the brain. Okay, you shut off basically from that point down. That's why it's very effective in childbirth, because you can submit your epidural to the back, to the spine, into the epidural space, not into the spinal cord, into the epidural space, which they want to be very careful not to hit the actual spinal cord. You don't want to damage it, but you want to release it into the epidural space, and then everything from that point below will be numb. And this is what it looks like. All right. Also mentions here that cerebrospinal fluid is withdrawn for analysis for conditions such as meningitis, encephalitis, and multiple sclerosis. This also can be done with the needle in the spinal area. Okay. This showing you some other things that we can do besides the epidural: lumbar puncture, spinal tap, and withdrawing cerebrospinal fluid. All right, let's go into the anatomy. All right, so spinal cord extends proximally from the foramen magnum to region between first and second lumbar vertebrae. Right? Foramen magnum to region between second and lumbar vertebrae. It does not go all the way down to the, what do you call it? I can't even think of the word right now. It doesn't go all the way down your back. The word is, I'm forgetting the word that I want to say. We don't go to the end of the spinal column. Okay, it stops before that, as we saw on the previous slide. All right, you have the narrow posterior median sulcus on the entire length of the posterior side. So on the back side, posterior side, you have a sulcus, and then on a wider anterior median sulcus on the anterior side. Also, we have this conus medullaris, cone-shaped distal end of cord, right? So it comes down. The spinal cord is not just a cylinder all the way down. At the end, it comes into like a cone. Filum terminae between first and second lumbar vertebrae composed of spinal pia matter. Then layer pia continues through vertebral cavity to form anchor. If this thin layer pia continues through the vertebral cavity, anchors the spine. Spinal cord has two enlarged regions: cervical, think of neck, and lumbar, think of lower back, lumbar enlargements. These are nerve roots arising from enlargements fused together to form spinal nerves that serve upper and lower extremities, respectively. Upper extremities, your arms; lower extremities, your legs. Spinal nerves are a component of the PNS, your peripheral nervous system. All right, so it's the peripheral. This is where the peripheral nervous, primarily where the peripheral nervous system connects with the central nervous system. Remember, we also have cranial nerves. Spinal nerves, they carry sensory and motor impulses to and from the spinal cord. Motor from, sensory to. Right, we have these posterior towards the back, anterior towards the front nerve roots. They're visible on each side of the spinal cord between the vertebrae. Right, so these roots, spinal nerves extend inferiorly from this conus medullaris and fill the remainder of the vertebral cavity. Bundle of a spinal nerve roots is called the cauda equina due to the horsetail-like appearance. Right, so it's a lot of vocabulary words. You don't have to remember all of them, but it's good to understand this diagram. Right, so notice here we have a cervical enlargement, so an enlarged part of the spinal cord here in sort of the neck area. Lumbar enlargement in the sort of lumbar region, lower back region. You have an enlargement. You have the spinal nerves, which are all these are longer than they're shown here in the picture, just showing you like where they start from the spine. Okay. Let's see what else I want to show you here. Vertebral cavity. That's where the spinal cord is located. The cauda equina here at the base here. Filum terminae, where it finishes, it sort of anchors here. Okay. If you look at it, we have interior median fissure in the front, and in the back we also have a fissure. See a posterior median sulcus in the back. Okay. All right, let's go into the internal anatomy of the spinal cord. All right, so it looks, because of the fissure and the sulcus, it looks butterfly shaped. And then we also have the way the organization of the gray and the white matter. So we have remember, it's reverse of the brain. The brain has the gray matter on the outside, the white on the inside. The spinal cord is reversed. We have butterfly shaped spinal gray matter surrounded by tracts of white matter in the spinal cord cross section. There's a central canal filled with, once again, cerebrospinal fluid. So there's, your fluid constantly is bathing the spinal cord and the brain. It's in the center of the spinal cord, surrounded by two thin strips of gray matter, connects each butterfly wing. Anterior to posterior orientation of the spinal cord can be determined by using shape and size of these gray wings. Anterior wings are broader, while thinner posterior wings extend almost to outer surface of spinal cord. That's how we can see the correct orientation of the spinal cord based on the shape of this, like this butterfly shape, right? So, so the anterior wings are broader, while the posterior wings extend almost to the outer surface of the spinal cord. So broader anterior wings, posterior extends almost to the outer surface. That's how we know the anterior from the posterior, the front from the back. All right, let's continue on with the anatomy of the spinal cord. Spinal gray matter makes up 3 distinct regions. Remember, we have the gray on the inside, white on the outside, a little bit, opposite of the brain. So how we divide it in the spinal cord, we divide it into the gray matter into the anterior horn, anterior wing of the gray matter, which leads to the motor nerves that will cause movement, motor nerve roots. Right? These are involved neuron cell bodies in this region involved in somatic motor functions. Remember, gray matter is unmyelinated, not myelinated. Posterior horn, or known as dorsal horn as well, gives rise to the sensory nerve roots, right? These are neuron cell bodies, unmyelinated. That means they're gray. And these lead to, in this region, process incoming somatic and visceral sensory information. So motor is sent out from the anterior, the front, posterior sensation comes in the rear, the back. Then we also have the lateral horn, only in the spinal cord between the first thoracic vertebrae and lumbar region, contains cell bodies of neurons involved in control of viscera via autonomic nervous system. Right, so anterior horn, motor root, posterior horn, not as broad, but extends almost all the way to the ends. That's your sensory nerve cell bodies. And then our lateral horns, if we have a lateral horn, is the viscera. Right? Lateral horn, viscera, control of the viscera, autonomic. Okay? Spinal white matter. And this is ascending and descending tracts. Contains axons of neurons that travel to and from brain. Remember, white matter, myelinated, sends information very quickly, allows spinal cord to fulfill one of its primary functions, relay station. Makes sense. Organized into general regions called funiculi. So we have the posterior, lateral, and the anterior, very similar to the gray matter. All right, so the white matter in each funiculus is organized into tracts, columns, spinal cord, bilaterally symmetrical. So left and right sides of the spinal cord have identical tracts serving their respective sides of the body. Ascending and descending tracts bring information to and from a specific part of brain. Right, sensory pathways travel posterior and lateral funiculi, while motor pathways travel in anterior and lateral. Right, so sensory information that's going to the brain travels in the posterior towards the back and lateral funiculi going up and down the spinal cord, while motor pathways travel also in the lateral funiculi and anterior. Ascending tracts carry various kinds of sensory information. We have the posterior columns made up of 2 tracts, medial lateral carries soma to sensory information, proprioception, touch. Nucleus gracilis transmits stimulus from the lower limb and lower trunk. Nucleus cutaneous from the limbs and upper trunk. We have the spinal cerebellar tracts. Just think of these as like railways in your spinal cords going up and down, sending information. The lateral spinal cerebellar tracts carry information about joint position, muscle stretch from entire body to the cerebellum. Anterolateral system includes the spinal thalamic tracts, which travel in anterior and lateral funiculi, transmit pain and temperature, right? I see this is just how information is relayed through the spinal cord to the brain. And then we have the descending tracts. So that's, remember, going towards the brain is when we're sensing information needs to go to the brain so that it can be processed in the brain, what we've sensed from our outside world. The reverse descending tracts transmit motor information down to the spinal cord from specific regions in the body. Cortical spinal tracts help control skeletal muscles below head and neck. Originate from your cerebral cortex. Dissociate within the brainstem. Remember, they go and cross over. Travel through the lateral funiculi of spinal cord. And deliver motor information to appropriate locations in anterior horn. So these are our descending tracts. Information coming from the brain, right? Motor information, different parts of the body.